Hi, I'm Julia, and on this channel I look at issues facing our environment and our health. Globally, we all face the threat of human-generated climate change. We all know that greenhouse gas emissions raise temperatures, alter rainfall patterns, cause sea level rise and extreme weather. These increase risk for floods, heat waves, droughts and fire. So I'm going to look at the ways that climate may affect our health. To find an evidence-based summary of climate on health, I looked at the 5th assessment report of the Intergovernmental Panel on Climate Change, the IPCC, that was published in 2014. Climate change affects our health directly, such as risk of death or injury due to extreme heat or other weather events, or wildfire. Hot weather increases our risk for heat-related illness or death. Extreme weather, such as tropical storms or hurricanes, can cause floods or damage that kill or injure. Climate change can also affect our health indirectly from environmental and ecosystem changes. These changes can occur from flooding, changes in rainfall, water runoff and warmer conditions. The result can be an increase in disease-carrying insects. For example, more mosquitoes increases the risk for malaria, dengue or Zika, or more ticks increases the risk of diseases such as Lyme disease. Other waterborne diseases like cholera or the pathogens that cause diarrhea are given an opportunity to spread with more water and warmer climates. And if that wasn't bad enough, changes in temperature and rainfall can increase molds or pollens that trigger asthma or allergies. My home state of California is impacted. It's estimated that Zika, West Nile virus and Lyme disease will all spread in the state. Climate change can have indirect impacts on health that are mediated through societal systems. This could be health problems such as undernutrition from altered agricultural production and food insecurity, or trauma from violent conflict caused by population displacement. The authors of the IPCC report also point out that there may even be damage to infrastructure, for example to healthcare systems by extreme weather events. So it's possible that in hurricanes, hospitals might be destroyed or lose power, impacting the availability of medical treatment. Climate change harms our health by exacerbating existing disease burden and by generating new problems for public health. And it's likely that poor and marginalized people will bear the most risk, with the greatest burden falling upon poor countries, particularly upon poor children in those countries who are most affected today by diseases such as malaria, undernutrition and by diarrhea. All of these are expected to increase with climate change, but none of the global population of humans are exempt. Heat can directly affect our health. Globally, vulnerability to extremes of heat has steadily risen since 1990, with 157 million more people exposed to heatwave events in 2017 compared with in 2000. And with the average person experiencing an additional 1.5 days of heat waves per year in the same period. The most vulnerable to heat are those whose work is outside, for example, farm workers and construction workers. And worldwide, more than half of all non-household labour hours occurs outdoors. Hot weather can lead to heat exhaustion, heat stroke, and even death. Occupational exposure to heat has also been associated with increased risk of traumatic injury due to accidents caused by sweaty hands or fogged up glasses. In America, according to the CDC, 600 people are killed by heat each year. In California, the number of extreme heat days are predicted to increase, putting more outdoors workers and those without air conditioning in their homes at risk of heat stroke and death. An indirect effect on our health arises from carbon dioxide being absorbed into the ocean. It's estimated that the ocean absorbs about 30% of the carbon dioxide released into the atmosphere from burning fossil fuels. This absorption of carbon dioxide has caused the oceans to become more acidic, which reduces fish populations. It means that marine food supplies are at risk, and this puts people at risk for undernutrition and for loss of livelihood, especially those in areas dependent upon fishing for their survival. Extreme weather with droughts and floods can impact agricultural yields. Additionally, climate change degrades soil because of temperature increases as well as changes in moisture in the soil. Already, global agricultural yields are declining, with 30 countries having downward trends in yields, reversing a decades-long trend of improvement. When it comes to California, we're not exempt. We have already and we will continue to experience agricultural impacts from drought and heat and freshwater scarcity. Climate change melts ice in the Arctic and Antarctic, causing sea level rise. It's already happening, and it will continue to rise even faster in the future. Sea level rise can impact coastal agriculture, fishing, ports and power plants. It can cause flooding from sea surges that can devastate and damage communities, and is likely to disproportionately affect those with less ability or resources to adapt. As populations cope with climate change, people will be at increased risk of mental health problems, from post-traumatic stress after extreme weather or wildfire, from violent conflict as we fight over diminishing resources, from poverty and from human migrations as we flee to safety. What are we doing about our fossil fuel addiction? Worryingly, global employment in fossil fuel extractive industries increased by 8% between 2016 and 17, reversing a decline that had been seen since 2011. Unfortunately, the effects of climate change will likely continue to amplify current health issues and additionally generate new problems for public health. So, what can we do about it? We can petition our governments to support policies that will reduce carbon dioxide and other greenhouse gas emissions. We need to move our industrial processes, our transport systems, and our agricultural processes away from fossil fuel use. Right now, we can modify the built environment, develop and use public transport, improve energy efficiency, switch to solar and wind and other sustainable energies, and facilitate carbon sequestration in forest plantations. We can eat whole food, plant-based diets, or at least make plants most of the food that we eat. We must replace the petrochemical products that we use every day, from fertilizers to plastic. As citizens, we can support all of these changes with our actions and with our votes. If you're a healthcare provider, what can you do? Well, find out about climate science and sustainability science, and talk to people about the health risks that they face due to climate change. Take a holistic view to think of the person in their environment. Be involved in advocacy and policy making. Climate change already killed 5 million people globally this year. Unless we act now, this public health threat will continue to kill more and more people. It's up to us to change our behaviours and recover from our fossil fuel addiction. Well, thank you for watching, and please subscribe to Your Care Plan on YouTube. It's free, you just press the button. Thank you.